You're sick. You don't know why. You're sitting in the emergency room, and the doctors and nurses don't speak the same language as you do. In our continued partnership with Intermountain Medical Center, we tackle the language barrier, in person and new technology being used to smooth out doctor-patient communication. Working in the emergency department at Intermountain Medical Center means encountering unknown situations and helping patients from around the globe who now call Utah home.
Every day, and sometimes several times a day.
That's how often Dr. Harland Hayes helps people who don't speak English. As an emergency physician at IMC, time is of the essence, and so is knowing exactly what's wrong.
90% of the time, perhaps, our diagnosis is made from talking with the patient, from taking an accurate medical history.
In any language. You're watching video conferencing for interpretation services, this one in Arabic, a language used by many of Utah's refugees. This is only used if an on-site interpreter isn't available.
We have over 50 Spanish interpreters, and we have Cantonese and Mandarin staff interpreters, and we hire out other languages as needed.
They're not only language interpreters, but act as cultural brokers.
Sometimes the cultural barrier can be even more of a barrier than language itself. Language is very obvious, but then there's all that cultural background that you need to understand in order to put things into the right context.
Easing concerns for patient and doctor.
I've seen that fear in their eyes or the worry in their eyes.
And no need to worry about this machine taking away jobs for in-person interpreters. It's only used when that's not available.
So when you come into the screen, you have the different available languages.
That includes patients who are deaf and need American Sign Language.
Are you having any fever or nausea or vomiting?
Whether in person or by video, as Utah's population becomes more diverse,
we can sense an increased need for these interpretation services.
Well, the Language Services Department within Intermountain Healthcare plans to upgrade its technology, video interpretation on the large TVs and some patient rooms.